Welcome to the Department of Healthcare Access and Information, or HCI, PIN 74, titled Skilled Nursing Facilities and Backup Power Source presentation brought to you by the Building Standards Unit here at HCI. This webinar will clarify Assembly Bill, or AB 2511, which requires that skilled nursing facilities have an alternate source of power to protect resident health and safety for no fewer than 96 hours for power outages that may result from a public safety power shutoff, an emergency, a natural disaster, or other cause. The process for which facilities will need to follow when requesting emergency authorization. So hold on tight and prepare to learn about PIN 74 and the alternate source of power requirements. If you haven't done so already, feel free to download a PDF copy of this presentation in the Go-To toolbox under handouts for you, and the actual PIN 74, which is available for you to download as well. We're here for about an hour and a half, which includes 1 hour presentation with about a 30-minute question and answer session at the end. Please make sure your questions are specific to this presentation. If you do have a specific question, you can also type it into the question section of the Go-To toolbox, and we can read those and answer in the background or answer at the end of the presentation. If you have a specific question related to a specific project or a specific situation, be sure to send us an email over to regsunit@hci.ca.gov. That's regsunit@hci.ca.gov. Again, please keep your questions that you type into the toolbox specific to this presentation. And if you have a question outside of this presentation, send it over to that email address, which we'll repeat at the end of the presentation as well. If you experience transmission difficulties, please log out and log back in using the same login information that the Go-To software sent you at the beginning when you registered for this presentation. Today for presenters, we have Mr. Richard Tannehill, who is Deputy Division Chief here at HCI, Mr. Jamie Schnick, Senior Electrical Engineer, and Mr. Rob Fisher, a Compliance Officer here at HCI. So once again, thank you for joining us today. So without further ado, I hand the presentation over to you, Richard.
Thank you, Caesar. Hello, everyone. Also joining us today for the Q&A will be Nancy Timmons, and Larry Enright will be available during the Q&A session. So today is another presentation on PIN 74. This is for Skilled Nursing Facility Alternate Power Source. We're going to kind of go through the requirements of this new law that was passed last year. We are sponsored, or partnered, I should say, with AIA California. This is self-reporting. If you are an individual registration, you will be able to download a certificate for each login that you have. So if you have a group of people there, you're only going to get one certificate, and then the rest will have to self-report on that. If you have any other questions on that, please contact the AIA. So back in September, the governor signed AB 2511, Assembly Bill 2511, into law. On the letter that he signed, there was a signing letter that directed HCI to begin the regulation process, which means we have been directed to incorporate anything in that law into the building regulations. Due to the cycles for the code cycles, this will need to be in effect prior to that code coming out. So what we did was created PIN 74 to provide some guidance on how to comply with this law. Okay, so we developed PIN 74. There's going to be a lot of text in this presentation, not a lot of pictures. So bear with us as we go through, but there's a lot of good information here. So we developed PIN 74 to provide a policy to implement the requirements of this law, which is basically to have alternate sources of power to maintain safe temperatures, maintain the availability of life-saving equipment, and to maintain oxygen generating devices for skilled nursing facility buildings. The law is now in the Health and Safety Code, section 1418.22. You'll hear it synonymously referred to as AB 2511, as that was the bill, that was the working bill that we've been working with. We presented a preliminary PIN 74 at the Hospital Safety Board meeting in November of last year. It was a joint meeting between almost all of the committees, and we presented that and was voted on to endorse the guide, the PIN, and then was also presented to the full board meeting in December. Okay, we also did a webinar just as same as this one. This one is updated a little bit, but we did one in December of last year. And like I said, we took what we learned from that, from the questions we got from that, and we updated this one accordingly. PIN 74 was issued on December 14th of 2022. And there is currently the online application process has been deployed on our e-services portal. Okay, we'll be talking today in the PIN. We also included an application as part of that, kind of a sample. But if you do it online, it'll be a lot better, and we'll go into that later as well. We're adding that information to this. So the upcoming HCI activities, we're presenting this webinar today on PIN 74, Skilled Nursing Facilities Backup Power Source. And we're also currently working on an advisory guide, it'll be A6, to help provide further guidance on providing a source for temperature control, life-saving equipment, and oxygen generating devices, and scheduled to be released in the next few weeks, probably in February. As I mentioned earlier, we have been tasked with incorporating the requirements of this new law into code. HCI is authorized to develop and promulgate building standards and regulations for the adequacy of safety of the skilled nursing facility physical plant pursuant to Health and Safety Code 1275. FDD, now known as OSHPD, is responsible for overseeing all aspects of SNF construction in California. As outlined in the Health and Safety Code 1275 and the 1422B, CDPH licenses long-term facilities, including SNFs, and conducts inspections in facilities with a CMS certification to determine compliance with federal standards and the California statutes and regulations to the extent that California statutes and regulations provide greater protection to residents or are more precise than federal standards. In other words, CDPH has enforcing powers over this law. HCI was only helping to get the assessments done and any projects into place if needed. So let's jump into the PIN. As Cesar mentioned, if you have questions, go ahead and type them into the question box in there and we'll answer them at the end. We tried to take a lot of the questions we learned from the last webinar and build them into this. So hopefully we'll answer those as we go. Okay, so PIN 74 actually has a very long name. It's Skilled Nursing Facility SNF Alternate Power Source to maintain safe temperatures, maintain availability of life-saving equipment, and maintain oxygen generating devices. That wording is there on purpose as that's what is required in the law. So we want to make it real clear in the title as we go through. So the purpose of this PIN is to provide a policy for the implementation of alternate sources of power to maintain safe temperatures, maintain availability of life-saving equipment, and maintain oxygen generated devices for skilled nursing facilities as mandated by the bill. So the background on this is currently skilled nursing facilities are only required to provide 6 hours of on-site fuel storage, such as emergency generators, and have not been required to provide emergency power for the cooling systems. AB 2511 requires that SNFs have an alternate power source to protect residents' health and safety for no fewer than 96 hours for power outages that may result from public safety power shutoffs or PSPSs, and an emergency, a natural disaster, or other cause. An alternate source of power is defined as a source of electricity that is not received through an electric utility. but is generated or stored on site, which may include, but is not limited to, emergency generators using fuel, large capacity batteries, and renewable electrical generation facilities. CMS may have and do have additional certification requirements that still need to be met by a skilled nursing facility. So in general, what that's basically saying that CMS still requires a generator to be on site for emergency backup power. So as of right now, we can't get away from that. These requirements are enforceable by the CDPH, the California Department of Public Health, and by January 1st, 2024. And that's the scary part. These facilities need to be in full compliance by the end of this year. This is an actual snapshot of the bill. You can see it's very, very short. And so our task was to basically put this into language that is understandable and usable and basically provide some guidance on what is required. So our policy implements the requirements as specified in that law, 1418.22. HCI will provide a technical basis from which a SNF can create a plan for identifying existing conditions that are already in compliance with statute, or to develop a construction project to achieve a compliant condition as required for acceptance by CDPH. And we'll go through the process a little bit later. We're going to be outlining that in a little bit more detail than we have in the past. The methods outlined and details described in this PIN indicate acceptable methods and details for achieving compliance with the law. Again, it is not limited to these. These are just examples that we're going to be providing and discussing today. These may be approved by HCI either in the office or the field. Other methods proposed by the design professional of record to solve a particular problem shall be reviewed by HCI and, if approved, may also be an acceptable solution. That being said, with the electronic process, we're probably going to be doing most of these reviews in the office initially, and we'll probably have a group that's assigned specifically to the review of these as they start coming in, and they'll expand to more of our staff. Few definitions that I want to go over. The first part of this identifies comfortable temperature per Title 22. I'm not going to get into a lot of detail on that because this is just kind of some history, but what I do want to look at is safe temperature under emergency conditions. And that is coming from the code, federal requirements of Federal Code of Regulations. CMS emergency preparedness requirement states that alternate sources of energy to maintain temperatures to protect resident health and safety and for the safe and sanitary storage of provisions. That temperature is identified as 71 to 81 degrees Fahrenheit. We are not making up the number when we come to this. We didn't just pull it out of the air. We are actually using federal guidance on defining what a safe temperature is. Okay, furthermore, CMS requires facilities to establish procedures that determine how heating and cooling of their facilities will be maintained during an emergency, including when there's a loss of primary power source. It is noted that the facilities are not required to heat and cool the entire building evenly, but must ensure safe temperatures and maintained in areas deemed necessary to protect patients, other persons, or for stored provisions. This is to be determined in your specific facility risk assessment. As of right now, we are identifying a safe area for temperatures as the patient care or resident care areas. If other solutions are going to be proposed, include them in the assessment, and those will be looked at individually. Other definitions, life-saving equipment. Again, you need life-saving equipment needs to be powered for 96 hours by an alternate source of power. It is defined, but not limited to these following examples: ventilators, AEDs, crash carts with defibrillators, intravenous therapy equipment, feeding pumps, IV pumps, nebulizer machines, suction equipment, and medication dispensing machines. So the facility in their assessment will identify any life-saving equipment that they have on their site. Most of this will be part of a subacute type facility, but that is up to the facilities to identify. Also, definition for oxygen generating devices. Again, 96 hours of alternate source of power is required. And these may include, but shall not be limited to, concentrators and positive pressure apparatus as identified in Title 22. So Jamie, is this where I turn it over to you, I believe?
Yes. So in order to help understand how we'd evaluate projects that are being submitted, I've identified that the law doesn't require emergency power for these new loads. It requires alternate power source. So I've identified that you could either take the tact of adding this to your existing 517 essential emergency system. You could take the path of adding this to a separate legally required standby system, or you could take the approach of introducing a interconnected electric power source, which would follow Article 705, better known as healthcare microgrids. We go on, I'll talk more about these. Next slide, please. Additional code sections and requirements. In addition to the electrical requirements, the law is very specific about that this equipment will remain in operation during natural disasters. So the special seismic certification is required for all the new equipment, and the 96 hours of on-site fuel storage. So this is above and beyond the electrical code requirements. We've identified the acceptable outage durations as 10 seconds for the life-saving oxygen generating equipment. And for the cooling and heating, it's just needs to be restored within sufficient time to maintain the temperatures between the 71 and 81 degree Fahrenheit target. So I wanted to talk about the 96 hours of on-site. And a lot of this language is directly from the law. So I'm just going over it here with you. It states that when generators are used as an alternate source of power, sufficient fuel on site shall be maintained to sustain operation for no less than 96 hours, or contract arrangements shall be made for fuel delivery for an emergency event. The law specifically states, if fuel is to be delivered during an emergency event, the facility shall ensure that fuel will be available without delays. And then we've added this piece that on-site fuel storage shall not be less than 6 hours capacity. So 6 hours on-site and either the 90 hours additionally on-site to get you to 96 hours, or if an acceptable approach for delivery, you can have 6 hours of fuel on-site and 90 hours delivered. CDPH will need to approve any alternate arrangements that have been made for delivery of fuel to meet this requirement. If you take the other approach instead of a generator and use batteries or a combination of batteries in tandem with a renewable electrical generation facility, again, it's still required to have this alternate power source operate for no fewer than 96 hours. And facility shall also make arrangements for delivery of a generator. That would be provisions of a quick connect provisions on the design on the site, and delivery of a temp generator and fuel in the event of power is not restored within 96 hours. Again, for all options, a minimum of 6 hours on-site fuel storage is required.
I just want to clarify that this, the option to have a delivery of a generator is only for the option for battery backup or a microgrid type system.
correct. There's been some questions. Can I meet the 96 hours by having a temporary generator and fuel delivered? But you're going to need to get the 6 hours with on-site resources. So next slide. California Electric Code section. So this is what we talked about, and I'll go into these a little bit more. I'm presenting 3 scenarios that could be implemented to provide compliance. Obviously, there's more scenarios that could be pursued, but I've just identified these 3 to demonstrate how we would apply code to these options. First one is simply using the existing facilities, existing emergency generator, or replacing the existing emergency generator and using your existing emergency system if there's capacity allows. The second one would be a separate generator independent from the emergency generator that only backs up the AB 2511 loads. And the third is a new healthcare microgrid, which would back up the entire site. So we're going to go through those now. Scenario 1, as I said, adding new loads to existing replacement generator. And this takes into account where the existing generator meets Article EC 517 healthcare facility requirements and has adequate capacity to support the additional loads required to maintain 96 hours of operation for temperature controlled life-saving equipment and oxygen generating devices. Again, these the generator, typically we would see these existing generators on site. If the capacity is there, that would be a great solution. You still are going to need to satisfy the requirements for 96 hours of fuel in that scenario. So we put together a couple single lines, and I tried to, each of these will be a standard SNF, and then there'll be a drawing is basically the same that looks at a acute care, subacute. So the existing SNF, we're assuming, and if there is no life-saving equipment or oxygen generating systems, now if you look over to the right, we have the existing on the top, the existing replacement emergency generator, and that currently feeds emergency distribution board, which feeds 2 transfer switches. One of those transfer switches feeds the equipment branch. So in this case, what you would need to do if it's determined that you need additional HVAC on emergency to satisfy the cooling requirements is just transfer the feeds from the normal distribution board to the existing equipment distribution board. And so that would mean transferring the feeds for some of your cooling equipment. And as long as the equipment has the capacity, you could do this. The existing generator will need to have adequate capacity to support this additional load, and we'll need to have provisions for 96 hours of fuel. So we're thinking this is the simplest solution for those facilities that have adequate capacity on the generator. The next slide is basically the same solution. So this is 1A, still have the existing generator. Now we're looking at a subacute, and we're assuming that the subacute would have life-saving equipment and oxygen generating devices. So in this case, we would think that typically most of the life-saving oxygen generating would be at the bedside with red plugs, would already be on the emergency system. And so the scope here would just be to transfer the HVAC loads. Again, the existing generator will need to have adequate capacity for these additional loads and meet the 96 hours. If there is life-saving equipment or oxygen generating that's not connected to emergency system, this would need to be refed with emergency power.
Yep. And again, this option is if you have capacity on your existing generator, or if you replace it with a larger capacity generator.
Thank you. Scenario 2 would be a new or additional generator that's independent of your emergency generator. We can go to the next slide, please. So in this scenario, again, all the way over to the right, we show the existing 517 emergency generator. And then you'll see on the top in the middle, we're introducing a new generator. And this generator and new transfer switch and new HVAC panel would all fall under the CEC 701 code for legally required emergency. And the requirements would be to refeed the HVAC loads from the normal to this new panel that's going to be our alternate source of power. The new generator transfer switch panel will need to be seismically certified, and the new generator will need to have provisions for 96 hours of fuel. In addition to that, the existing generator will need to have provision for 96 hours of fuel. So in this case, the building is intended to be occupied for 96 hours, and the life safety systems on the existing generator will need to be operational for those 96 hours. Again, this is simple. Basically, if it's a subacute, it would be the same approach. New generator, new transfer switch, new panel, you transfer the HVAC loads to the new panel. And if there are some life safety equipment that's not on emergency, you would need to transfer that over. Again, the new generator, transfer switch, all the equipment would need to be seismically certified. The new generator would need to have fuel for 96 hours, and the existing generator would need to have fuel for 96 hours.
Jamie, I have a question on the previous slide here. Let me go to it. Now, this one, wouldn't this existing generator only require 6 hours of fuel because there's no life-saving equipment on it? Or is this still?
Well, so our code for life safety is predicated that the life safety system will be fully operational for the duration of the occupation, for the duration of when the building is occupied and up to 90 minutes afterwards. So that's a really good question. And basically when we're saying we're putting the life saving and the cooling, then we're intending that this building is going to be occupied for 96 hours. And so we need the life safety systems to be operational for those 96 hours. A really good question. Thank you. Scenario 3 is a new healthcare microgrid, and we'll go ahead and I'll run through the slides with this. Now this gets a little crowded, but it starts off with the existing emergency generator on the right, the main distribution board on the left, and now in the center here is we're introducing a new microgrid, and we're showing, in this case, we don't expect that a microgrid is going to be designed and installed that has a microturbine and PVs and batteries and fuel cell, but we're just showing this for example. Any one of these could be used, any combination of these clean energy producers could be used, but essentially what we're pointing out is that there is a temporary generator connection required on this microgrid, and that microgrid then ties into the main distribution board and parallels with the main distribution board. So now in this case, you're backing up the entire facility with the microgrid. So let's look at the requirements. The new microgrid will need to be seismically certified. It'll need to have 96 hours of fuel provisions with 6 hours minimal on site. In this case, the existing generator would only need to have 6 hours. And someone might ask, why? Is this the one case where it only has 6 hours? Well, the entire facility is being backed up for 96 hours. So the emergency system, the life safety system, everything is backed up for 96 hours. And that's being done by this microgrid. And so you would not need to supplement the fuel for the existing emergency generator. Another requirement, and I showed here, is a quick connect for a temporary generator is required. And one thing I'll just point out, and this gets into the design, this is a 705 code, is this main distribution board, MDB, is going to need to be sized so that 125% of the distributed energy resources that are introduced plus the main breaker is less than 120% of this board. So essentially the 705 code says I have multiple sources. I need to make sure I'm not exceeding the rating of this board. And typically what we see is that this, when existing condition is the main distribution board, main breaker, and the main board are matched. I'll say, just for instance, 600 amp breaker and a 600 amp board. But what we see is typically that the actual demand load on this board is lower. So what we've seen successful is this board, this main breaker being downsized to allow you to add this microgrid and still work with the existing main distribution board. If you take this approach, we would highly recommend that you would get your demand load readings from the utility and evaluate that you could still use that main distribution board. Typically, we see that to be the case. Next slide is really no difference. So if you do have life-saving, we're still backing up the entire facility with the microgrid, and so there is no more changing. A couple of the things that we didn't see that we saw on the other approaches is you don't have to transfer the HVAC loads from one board to the other board. You just leave the existing electrical system as is, and you just attach this new microgrid to back up the entire system. Go ahead for the next slide. So in order to get started, we've put together a power assessment, and we'll talk through the process of how you evaluate your facility initially. And Robert Fisher is going to go ahead and take over the presentation now. We can go to the next slide and he'll talk you through how to do this.
Thank you, Jamie. Robert Fisher here, and I'm going to show you the basic steps just to get to the e-services portal and start the submission process. So the document is section 22, SNF backup power source assessment. And if you go to the hki.ca.gov and go to building safety and finance, and then to e-services portal, you'll come up to a page where that user guide is down about halfway down the page. So you want to open up that user guide, and it will give you all the things you need in order to submit, both the preparatory things you need to do and then the actual step-by-step during the submission process. This is just like any other project submission. It is similar to the expedited building permit if you've ever used that, but and again, it's just the same submission as any other record if you've done that. Next slide, please. So again, the user guide 22 shows you everything you need to know, and you have to prepare. You have some things to do to prepare for the submission, some documentation you have to do. So next slide, please. So we need a floor plan showing the location of the equipment and the area of coverage, and any documentation that will explain how the devices in the facility are compliant. And then if you have any documentation for proposed remediation of those, there's more of an optional one because you haven't gotten, that's basic construction work that has to be done. And so you basically will be non-compliant as of now. But if you want to supply that, we will definitely appreciate that information if you have it. But don't not support or do not submit the application because you don't have your remediation or all your proposed work figured out yet. We do want to get the assessment done fast for you so that we can give you information back. You'll have to have information about the generators, the heating and cooling system, and any alternate power source that you have. Just basic make and model and fuel type information. That's part of the application process. And then each one of those different systems that is described inside of the new law, if you do have those at the facility. again, any devices that are not at the facility, when you go through the submission process, those will be excluded. So next slide, please. So again, going back to the HCI, that will get you to this, and you go to the esp.oshpod.ca.gov, and you want to go to the enforcements module rather than the projects. Projects is where the normal construction projects are. Enforcement is where all of the enforcement records will be. And you click create an application. And I didn't show every screen here, but after a disclaimer screen, you will select the SNF backup power assessment, and it will begin the submission process as detailed in the user guide. Next slide, please. The main part of the submission process is a group of questions about each one of those devices. In there are links to resources if you have questions about Pin 74 or the advisory guide or anything else. You can access them through here. And you simply give an answer to each question. And as you answer the question, down at the bottom, they will show you which questions have not been completed yet. And you simply answer the questions. Some of them will disable other questions. If you say, I don't have this particular system at this facility, it will disable those questions. But just answer the questions, and at the end, it will show you some requirements. So next slide, please. So as you answer each question, if it's a no, it will disable other questions that are not needed. When you get done with it, or as you answer each question, this list of requirements will slowly build so that it will list all the things that need to be done. Next slide. And once you have completed the submission process, this same questions and answers and all the information you've entered is available in a report. So you'll go to the actual record that you've just created, and you go to the reports link up at the top and select SNF assessment client summary, and it will show you all of the information that you have just submitted with both the questions, the answers, and the requirements that are come from us. Now, this is just a preliminary requirement. After you submit it, we will do a review of the submission and then get back to you with our findings. And I believe that's the last slide on. Oh, yes, thank you.
Yeah.
And then the flow chart of how the process will work. So basically, you will submit the application to us. We will review it. If we find it as there were any remarks, we will send them back to you. You resubmit with the corrections, and then we will review it again and hopefully get to the point where we can decide whether or not it's compliant or not. If it is compliant, we will submit our findings to CDPH for their concurrence with that. And if all is good, we will give you back a letter saying everything is compliant. If non-compliant, we will send you back a letter saying you're not compliant, and then we'll have to talk about the non-compliant possibilities of whether or not construction take place or if there's other options. So
Yeah,
this will flow chart kind of gives you.
If CDPH determines it's not compliant, we will forward those comments to the design team.
Then
Go ahead,
hopefully, hopefully at the end we are compliant. So there probably will be construction involved, but this is just a quick.
Yeah, if the facility is determined not compliant, we will not send it to CDPH, and you'll probably submit a project or a series of projects to come into compliance, and then you will, the previous assessment will be closed non-compliant. Once you do the projects and you believe that you are in compliance now, you will start a new assessment and go through the process all over again with hopefully a different outcome at the end stating that you are compliant, and you'll get your letter.
I believe that is the last slide.
So great. Thank you, Rob. So again, if you want AIA credit, you can download the certificate or do a self-report. And we'll go straight into questions. Again, we have Nancy Timmons, Larry Enright, Rob Fisher, and Jamie Schnick and myself to help answer the questions. So please enter your questions into the chat and I'll turn it back over to Caesar. Thank you all.
Great. Thank you, Richard. As Richard mentioned, if you have a question specific to this presentation, feel free to type it into that go-to toolbox there under the questions section, and we'll be able to read your question here in a formal setting and answer that question, hopefully. If you have a specific question that's related to something else, specific project or specific issue, feel free to send us an email over to regsunit@hchi.ca.gov. That's regsunit@hchi.ca.gov. So with that being said, I'd like to ask the first question that we received throughout the presentation. The question reads, is the 96 hours of fuel based on design load or generator's rating? And Jamie, that might be something for you to answer.
Yes, the 96 hours would be on the actual load. So it not on the generator rating. So in this case, we would assume that most of the equipment is existing and that you would be able to meter those loads using the pin 38 and CEC 220, take those loads at 125%, and then you would need to operate, you'd be able to use that for your fuel calculations.
Great, thank you, Jamie. We have a next question here. The question reads, is there any provision listed to be floodplain level or high above grade? Is there a diesel fuel source? Are they exempt from air resource rules for testing and actual runs?
Caesar, I can take this too if you want. Part of it, we're probably a multi-person answer here. So for the flood hazard, and this is Nancy Timmons. Thank you for joining, by the way. For the flood hazard part in CFC 1203.1.8, there are provisions that refer to the flood hazard areas that are established in the CBC 1612.3. And then that will lead you further, the language there will lead you to ASCE 24 for the location for that. And then yes, for the diesel, there are requirements to comply with CUPA, C-U-P-A. And if you look at our PIN 2 on our site, you'll see information there for that, as well as on our reminder list for our local authorities, there's information there, and that will refer you to CAC, the admin code 7-125B, and that information comes from the health and safety code. So yes, they would have to get the approval from CUPA, and if they're in a floodplain, there are requirements to comply with for location and installation when it's for the floodplain, excuse me.
Okay, thank you, Nancy. And they are not exempt from air resources rules. You still need to get Air Resource Board approval prior to operation.
Great, thank you, Nancy and Richard. Next question reads, will a natural gas connection for fuel satisfy my requirement for the 96 hours?
No, we've, just as we've always viewed it, is that the natural gas connection is not designed to withstand earthquakes, and so you would have to address the fuel storage separate from that. It could run on natural gas, but as far as backup and runtime, you would have to have resources on site stored to get you the 6 hours minimum or 96 hours.
Great, thank you, Jamie. And this question might be for you, Jamie. It's a clarification question, and it reads, if the facility has a diesel generator backup, does not have 96-hour fuel supply, can you not apply the option of being able to deliver the fuel to get to the 96 hours?
So yes, that was kind of my option number one. If you have a generator that has adequate capacity to pick up the new loads, then you would need to meet the 96-hour requirements, and the 96 hours could be met one of two ways, either 96 hours on site or 6 hours minimum on site with arrangements with the contract for delivery. Now, there's been a lot of questions of, can that fuel actually be delivered in the event of emergency? That's going to be need to be presented clearly, and CDPH will review that for acceptance.
Jamie, so this kind of runs into the next question. So the next question reads, if an existing heating is provided by natural gas, any additional requirement for alternate fuel source is not required for heating hospital?
So we're looking at the emergency power source. So the emergency power source would need to have the fuel stored on site. And if you have heating that depends on natural gas, we won't be looking into that to see how that would be maintained.
Yeah, I'd like to add to that is, even though the law specifically states heating and cooling, they specifically identify electricity for a backup power source. So our assumption is actually more for cooling. Again, we can't eliminate the fact that if it's cold weather, there should be some means for heating, but it doesn't specifically address that. So that is something that would need to be clarified, because the electricity is primarily going to be for your cooling loads. And the law specifically states electrical power sources.
Richard, this next question, or maybe this question is for Larry. The question reads, for existing facilities, HVAC equipment is very likely not seismically certified if not subacute. This HVAC would have to be replaced with seismically certified equipment, correct?
No. That's the easy answer. We are not requiring existing equipment to be replaced. Any new equipment would have to be seismically certified. If you have existing equipment that meets the requirements and you can deem yourself otherwise compliant, that can be left alone. Or same thing if with option 2, if you're adding a second generator to meet the requirement, the first generator does not need to be replaced or any seismically upgraded. If it's existing equipment that's compliant, is going to remain on site and in use, it can be left as is.
All right, the next question here, thank you for that. The next question reads, in scenario 2, when installing a new generator under CEC 701, it would then be required to have selective coordination rather than 0.1 coordination per section 517, correct?
That's correct.
All right, and then for added legally required generators, in addition to existing 517 generators, do the added generators need to be NFPA 110?
Yes.
Yes.
Yes, they would need NFPA 110. I think what you're going to find is the one difference between 701 and 517 is on the transfer switch. 517 requires isolation bypass and 701 doesn't.
Great, thank you for that, both Jamie and Nancy. The next question reads, when is the completion of the assessment application required?
Now, actually, we kind of didn't go into the timelines. The law went into effect January 1st, so about 2 weeks ago. Per the law, these need to be compliant by the end of the year, so less than 12 months from now. It is recognized that those are unrealistic timelines, but that's what the law states, so that's what we're working under. We are currently in talks to address that issue, but as of right now, it is still basically everything needs to be installed by the end of the year. We do recognize that the lead times on generators are much longer than that. So that is something we're working through. But again, the PIN is only identifying and describing what's in the law, as well as providing a means to do the assessment. So the assessments can start coming in now. It's up and it's live. So you can start doing the assessments now. What we're recommending is that assessments be done over the next couple months, that plans, if required, if it's non-compliant, plans can be submitted over the next few months after that, and that the latter part of the year can be used for install. Again, we know that's not realistic, but that's the only timeline currently we have to work with.
I'll just add on, there has been people, I've got a number of conversations about how the solution takes place, and really the very first step to solve this is the evaluation to determine what is out of compliance, and then looking at the design to solve that would be the right time to look at that.
Great, thank you, Richard and Jamie. The next question deals with HVAC equipment and special seismic certification. So Larry, this one might be for you. The question reads, is special seismic certification, or SSC, now required for all new HVAC equipment serving all skilled nursing facilities, or is SSC only required for new HVAC equipment required to maintain a safe temperature for residents, quote unquote? For example, would SSC be required for items such as air conditioning equipment solely serving admin spaces, kitchen hood exhaust systems, or HVAC equipment serving electrical equipment rooms?
Hi, this is Larry Enright. For the remodel can, replacement of certain equipment does not require special seismic certification, but however, based on the assessment, if there's the areas included in the assessment, those would need to be included. Areas outside, they would just fall under the basic part 2, volume 2 requirement in chapter 17. So some of the areas listed below, or listed in the question, I believe would not need that.
Yes, I'm in agreement with Larry. This is Richard. So what you would want to do in your assessment is identify the space that you're going to be considering safe temperature zones for residents. As I said, our default is the resident care areas. So the admin areas would not be included, things like that. If you have a different type of proposal, those will be looked at, like bringing everyone into a certain area. Again, we don't want people crammed into a single room. So that's why we're looking at the patient or the resident care areas.
So does emergency power need to be hooked up for heating and cooling equipment?
So this is Jamie. We identified 3 scenarios. One would be that, and typically we would think if the facilities are code compliant now, the heating would be backed up by the emergency generator. We would also think that there's a good chance that cooling is not backed up by the emergency generator because that was not required by previous codes. So there's 3 options. One is to pick up the cooling with the emergency generator. The other is to have a separate generator that creates a new branch, a legally required standby, a legally required emergency. Or the third would be to back up the entire facility with the microgrid. So the cooling does not need to be hooked up to the existing emergency generator. That is one option that will meet code.
Yeah, and if the question is more about the heating, as I said earlier, the law actually seems to address specifically cooling loads. Where this came from was in Florida. After one of the hurricanes, they lost power for several days, and because of the high heats and humidity there, they did have some deaths due to the power outages. So what the assembly tried to do is provide some means in California so that wouldn't happen here. So it really, even though it mentions safe temperatures and heating, it really only addresses the electrical for cooling loads as being required. Again, as Jamie is saying, we're assuming the heating If you have natural gas, if it's just a PSPS, that should continue to work, and that anything operating that equipment would be on emergency power.
Great, thank you everybody for those answers. We have a next question here. The question reads, are all SNFs required to go through the assessment and upgrade their generators to meet the 2024 deadline?
The easy answer is yes. The only exceptions right now are hospitals that have distinct part SNFs within the hospital building. So if they have a distinct part that is external to the hospital, that still needs to meet the requirements. But if it's part of the hospital proper, within the actual hospital building, it does not need to meet that requirement. It would fall under the hospital requirements. But any standalone skilled nursing facility, no matter how old or new, needs to meet this requirement.
And I just want to jump in, the question is read, do all emergency generators need to be updated? And so maybe I'll go in just a little bit more detail about the microgrid solution. So there is equipment out there that can be connected to the parallel with the normal system that would generate power on site and operate 24/7. We see facilities looking at this because it gives more than one benefit. Number one, it gives the benefit of resilience. So if the utility goes out, the distributed energy resources or the on-site power generation would continue to operate. The other benefit of that is cost. So when you're generating on site, you can certainly knock down your demand loads. You can also produce energy cheaper than utility in some cases, and so that you would reduce your annual operating cost. And then the third benefit is just the environmental benefits as far as on-site clean power generation. So that's why we included that option for the microgrid and paralleling with the normal service, so people would be aware that there are options other than emergency generators, diesel generators.
Yeah, and looking at this question, I just want to clarify my answer as well. All SNFs are required to do the assessment, as I stated earlier. There is no requirement to upgrade the generators unless there's a deficiency. And again, the requirement is not necessarily to upgrade the generator, but to meet one of the options provided or provide an option that would be acceptable.
Yeah, that's a great clarification, Richard. Thank you for that. For the group, and this question is going back to HVAC equipment and certification. The question reads, would this mean that OSP numbers are required for all HVAC equipment?
So this is Jamie again. I think what we've said is that new equipment introduced to meet this requirement would need to have OSP. And so existing equipment would not be looked at.
Great, Jamie, thank you for that. The next question seems to be geared towards those that are a little concerned about the requirement. And the question reads, can there be a designated area for each SNF that meets these requirements, or would this have to be met project-wide?
I'm not sure I understand the question.
So the way that
I'm assuming this is isolated.
Yeah. So
Yeah, this is isolation parts of the building. I think we already addressed that you can provide a part of the building that meets this requirement. Again, in the assessment, you would need to explain that. Again, I'm not sure if I'm answering that question correctly. So Caesar, if you have a better take on that.
Yeah, I would actually ask that the person who wrote the question try to clarify their question and type it into the question box again. So that would be appreciated. In the meantime, we can go on to the next question, which has to do with the electrical requirements and OSPs again. So the question reads, when refeeding an existing normal branch panel from an emergency branch, surge protection would be required to be added, but an OSP for the panel would not be required if the panel is physically not relocated, correct?
Let's see, this one's definitely mine. So when refeeding an existing normal branch panel from an emergency branch, so I take it they're not transferring circuits, we're transferring an entire panel to go under the emergency branch, then that new panel would become part of the equipment branch. And so surge protection would be required. The existing panel would not be looked at for OSP. So I hope that answers the question.
Great, thank you, Jamie. The next question here reads, do you know of any AQMD leniency for proposed new generators due to the short time deadline?
No, as far as we
No.
know, heard nothing
Yeah.
from air quality management boards anywhere. As far as I know, they still need to meet full compliance prior to operation.
Great, thank you both. The next question here is, and we're almost done, so feel free to type your question into the go-to question box if you have a question. If not, you have the option to send us an email over to regsunit@hki.ca.gov. The next question reads, is a gas-fired heating unit to maintain 96 hours of on-site storage too?
This is Larry. So the fan power, the controls, all the electrical power would need to meet the 96 hours fed by on-site. The gas basically itself for burning would not be looked at, not included with this requirement.
All right, thank you, Larry. The next question deals with the CFC, and the question reads, 2022 CFC section 1207.1.1 table, energy storage systems, ESS, threshold quantities with batteries, lithium ion batteries, no to exceed energy capacity 20 kWh. If exceeds, then requires more plan reviews and permitting with reporting to Cal EPA. Is that something that we could answer?
Sure.
Question.
Sorry, Richard.
I said that's a Nancy question.
Yes, so yes, there are additional requirements when the capacity exceeds that amount, and with that, there's more detail that it gets in that we'd have to get into than what's probably appropriate to get into here. But for example, one would be, depending on the location of it, if it's inside of the building, then a rated room is going to be required. And then there are specifics for that rating and openings, allowances. If the wall, if you have an exterior wall and the what has to happen, you know, if you have, say it's a 1 hour fire barrier, for example, and then if you look in the code for when you normally have a 1 hour fire barrier, what those openings could be rated at, there are allowances for other fire barriers that do not apply when those fire barriers are required for these rooms. So there's more that goes into that, but yes, the short answer is if those rooms have the battery storage in them that exceed what's in the table, those rooms will have to be rated. And for the requirements, again, with Coupa and all that they look at, that all comes into play. That's more for the tanks. As far as the EPA, that one, Richard might have a little more information with that, but there are requirements that are going to have to be met for those. And you know, it kind of makes it confusing is it depends where it's at. So when you look in CFC, you'll see different requirements that are, they're different based on where that equipment is located. Is it in the building? Is it in the hospital building? Is it in another building? Is it exterior but within an enclosure? Is the enclosure mobile? So that's why I say the answer is deeper than probably what we can get into right now, because the answer is going to be what you're used to hearing is it depends. So, but yes, there are additional requirements short answer is there are additional requirements for those capacities when they exceed those capacities, as well as what type of enclosure you have this the batteries in.
All right, thank you, Nancy, for that. Great answer, great question. The next question here reads, NFPA 110 indicates fuel stored for 96 hours based on the running maximum kW rating of the generator. On this specific pin 74, we are following pin 38 to size the fuel stored in lieu of the generator's max kW rating.
Yes, so we're going on the actual demand of the load that's being backed up by the generators, and the fuel storage would be required to get the 96 hours.
All right, this question here is more of a clarifying question. Are there any safety issues of storing much fuels for 96 hours?
Absolutely.
Yes.
Go ahead, Nancy.
So, no, it's okay. I mean, the short answer, yes. As far as where do you want to go with this question? Again, there are multiple requirements for the storage of fuel. A good place to start is take a look at our site. We have reminder list on our site for you start with the code, but start with I would suggest starting with the reminder list because it'll guide you to the sections of the code that apply. And it's if the tank is underground, it's above ground, if it's over, for 660 gallons, for example, and then if there's different capacities that you have to look at. But I would start with our reminder list, look at those sections that are listed alongside the points, and take a look in the code to see what applies to what you have for your design.
Great, thank you for that. Thank you for the answer. Richard, will a link to the assessment be made available?
Yeah, it's actually in the handout that Rob went through. It's just through our e-service portal where you apply for projects. That it's in the handout. So yeah, that's how I would get there. As Rob said, if you go to our website, it's section 22, I believe, for the instructions on how to do this, everything will be right there. If you've applied for a project previously, it's the same link that you go to apply for projects through our e-service portal. Rob, did you want to add anything to that?
Yeah, well, yeah, a public user account is required. So if you haven't created one already, there's a register for an account there on that page. But yes, you do need to be registered, and it's a different module than the regular projects, but it's in the same web page. So.
All right, thank you for that. The next question here reads, option 3 included a requirement for a temporary generator connection. Would this connection be made to the EDB or the MBD?
Where I was showing it was on the microgrid bus, but it could also be connected to the main distribution board. The reason I'm showing it on the microgrid bus because I think that's definitely a new piece of equipment that's going to be introduced, and so it could be easily installed under original construction.
So Jamie, speaking of microgrids, does a microgrid equipment need to be seismically certified? If so, does that equipment currently exist?
So the bill is very specific that the equipment used to provide alternate power for these loads identified, cooling, life-saving equipment, and oxygen generating, be able to operate during a natural disaster, which then requires that it's seismically certified. So this has been a chicken and the egg with the vendors. We've have been having discussions about this for years now, and I understand that people are looking at getting special seismic certification for microturbines. I understand that people are looking into getting special seismic certification for fuel cells. Some of the battery systems already have special seismic certification, so it's definitely a challenge. That equipment that does have special seismic certification is on our website, so that could be looked at. But I think that this new requirement ideally would help speed up the vendors' pursuit of special certification for their product.
All right, thank you, Jamie, for that. Next question reads, if the heating unit is natural gas and heating is required to be maintained for 96 hours, 71 to 81 degrees, what happens if, say, an earthquake breaks down the gas supply? How is heating to be maintained?
It won't. That should be addressed in the emergency plan. You may have to evacuate. You may have to find other means. If there's no natural gas and your heating is powered by natural gas, and then it goes down. So there needs to be a solution in the plan to address that.
All right, thank you, Richard, for that. Then the next question reads, if the heat source for the facility is propane or diesel, i.e. not natural gas, is 96 hours of reserve fuel required to be on site?
Well, again, the answer would be you have to have 96 hours of either fuel or ability to refuel, a plan to refuel. An agreement, not just a plan. It has to have a contract or an agreement with a provider for delivery.
Okay, and the last question that we have here, I'll read it out loud here. If an LP tank has 96 hours capacity, is propane engine generator approved?
Bridget, that is an option, but again, it would have to, of course, meet all the code requirements that are needed for that, location, property, capacity, etc. We'll just submit that for plan review.
All right, and that brings us to the last question. So that was it. I am looking for questions that are typed into the go-to question section here, if so we can have an opportunity to answer all the questions that you may have. If you think of a question that maybe after this presentation, after this webinar, that you'd like to send us, or even have a offline conversation about a specific project, send us an email over to regsunit@hki.ca.gov. Again, that's regsunit@hki.ca.gov. And we'd be happy to have that offline conversation or answer a specific question that you may have.
Yes. And just note that even though the screen states oshpod@ca.gov, that email address will still work, but please use hki.ca.gov and we'll update the slide.
Correct, yeah. So both email addresses will work. We will receive your questions. So send us an email to either or, but as Richard pointed out, the hki.ca.gov email address is preferred. So that brings us to the end of our presentation. We hope that you found this webinar to be helpful. Please remember, if you didn't download the PDF handout, and the pen, you can access them under the handout section of the go-to toolbox, and you can use those for your information. If you do have a question, send us an email over to regsunit@hki.ca.gov. It's been a pleasure being here with all of you today. Thank you for what you do and doing your part in providing access to safe, quality healthcare environments throughout the state of California. All of the presenters, thank you so much for being here. Nancy, Larry, Richard, Jamie, thank you so much. Anything else you'd like to add before we leave?
And Rob.
And Rob.
Now, I just say, I really appreciate the questions. There's some deep thought here, and we will be responding to the questions and post that as a link, in written form. So thank you for bringing the tough questions. There's a couple things to look into for sure.
Absolutely. the questions are great, and questions and discussion after this presentation is welcome if you'd like to have that discussion. So send us an email, and we'd like to sit down and talk to you. With that
Thank you,
being
everyone.
said, thank you so much. Have a great day.
Thank you.